Okay. Let's look at those eyes and see what's happening there. Okay, we'll have you look straight ahead. I know it's a bright light, but just keep looking straight ahead. Okay. So it does look like you have some cataracts, indeed. That's why you're having the problem with your vision. So you probably know a little bit about what goes on with cataract procedures. It is one of the most successful kind of procedures that we do these days. It's all done as an outpatient, and not even done in the hospital, done at our ambulatory surgery center. And when you come in, we do need someone to drive you. And when you're in there, we're going to start a little IV to give you some wonderful medicine to make you nice and relaxed. And that way we can then block everything around the eye that we're working with. And we only do one eye at a time, by the way. We'll do one eye, and then if everything works out, probably do the second one a week or two later. But when we block the one eye, you can't see anything that I'm doing, you cannot feel anything that I'm doing, and you're perfectly comfortable. And when it's over with, you're able to go home same day and get back to your normal activities right off the bat. Now, when we're removing the cataract, what we're doing is we're removing the cloudy lens of the eye, and we have to replace that with something that focuses, and that's where the implant comes in that I'm sure you've probably heard about. Now, this is not a contact lens. You don't feel it. It's internal, so you have no feeling on it, but it does all the focusing for you. And there's different styles of implants, including some of the specialized implants that can get your vision so strong for distance and close-up that you wouldn't even need any glasses, which would be pretty cool. Now, these lenses, they're called a lifestyle implant or a multifocal implant. And these are things that we need to discuss with you and educate you when we bring you back for the pre-op visit. We also have to educate you on the type of procedure that we would suggest doing, because if I was having a cataract procedure done, I certainly would want to have it done with the laser, because with the laser it takes things to a much higher level of precision and avoids the use of any blades. So that's an important area that we concentrate on. Now, we do have to look at your insurance, because in truth, your insurance will cover the basic procedures, but some of the other things are not always covered by the insurance. I know you're always wondering what's covered, what's not, but what we do need to do is when we bring you back for the pre-op visit, we'll look at your insurance as well and lay it all out in black and white, what's covered and what's not. We have to do a bunch of measurements so we know the type of implant that's right for you, and get a bunch of paperwork done so that we can maximize our insurance coverage. But the important thing to understand is cataract procedures are very routine these days. We have the capability of getting you to see really a lot better, and possibly even be able to see in the distance and close up with no glasses whatsoever, which would be pretty cool. So what we're going to do, unless you have any questions, is let's take you up front and we'll schedule that pre-op and at least take it to the next step. Sound like a plan?
Sounds like a plan.
Good.